There are plenty of ways to extend the time that we live among our neighbors. And in fact, it is best for us to live among our neighbors and places and people who know us for as long as possible. We're trying to create a blue zone here in this region, and I'll explain what a blue zone is in just a minute. Can I not? Whoops, there. Okay, so Betsy Buford said I had to tell you a little bit about myself. Some of you know me from years ago when I did the Oakwood Project with Peter Rumsey and other neighbors, interviewing about 50 folks who lived in Oakwood to gather their stories over time. Before I became an elder consultant, I also taught at Duke. I taught in the School of Public Policy, the Center for Documentary Studies, and the School of Medicine on how to use stories to impact people, change public policy, or teach. Some of you may also know that along those lines, I wrote a book with my son. He wrote letters to dyslexics all across the country because he is severely dyslexic, and asked them for stories on how they made it in spite of their learning challenges. It is fitting to tell you this because stories are what inspire us. Stories are what we remember. And so the bulk of my presentation today will be about people whose stories might inspire your own. How did I get into this? I came in through the doorway of personal experience. While I was teaching at Duke, my husband's father moved in with us after he was diagnosed with stage 4 lymphoma. And while trying to balance children and 3 generations in one household and work, I started writing about it for the New York Times, documenting our journey until he passed away. Given this, people started asking me to tell our story, and WREL invited me to begin writing a column for them. They created a section called Aging Well, and over the last 3 years, I've written over 200 columns on all kinds of issues related to aging. So let's back up for a moment. This is a picture of me and my grandmother. We were very close. She lived in Smithfield. And while I was in graduate school, after my grandfather had passed away, I would often go visit her to take her to K&W for lunch or to the doctor's office. She always insisted that I drive her in her Cadillac. And I remember clearly one day arriving there. It was a hot summer day, and we both slid onto the sticky plastic vinyl seats in the Cadillac. And I pulled out of her driveway onto Route 1. And we smiled at each other. And slowly I started noticing the red lights coming on her dashboard, one after the other. And I was worried, of course, that this signaled we needed to pull over, the car was going to blow. I looked over at her alarmed. I said, "Grandmother, all the lights are on. We should really pull over." And she just smiled at me and she said, "Oh, honey, don't you worry. Those lights will go off in just a minute." I mention that story because it is kind of how we approach aging. We assume that it's not going to happen to us, and that even if we get a few signals, the best approach is just to ignore them. Can't we talk about something more pleasant? I don't know how many of you are New Yorker fans, but Roz Chast, a wonderful cartoonist for the New Yorker, drew a cartoon memoir about taking care of her parents as an only child as they declined over time. It is entertaining and true and apt and relevant. So why talk about things? Because it helps us see aging as normal and maybe even plan for some of the most common needs or challenges. Talking about things reduces anxiety about the unknown. It might even help you cultivate a peace of mind as you enter into the next stages of your life. Talking about things also provides an opportunity for growth, something that is a human need until the very end. Let me just take a sip of water. Check your blind spot. We humans always assume that aging is going to happen to someone else, but not to us. There is not one person who I have worked with who has not said to me, I'm not going to move into one of those independent livings or anything. I am young. Those people are old. But by doing that, again, we ignore and might risk finding ourselves in a crisis without any idea of where or how to deal with it. We don't have to look too far to realize that it's common to need some help at some point in life. For example, in my family, on the left-hand side is my mummi and ukki, my mother's parents. She's from Finland. As was often the case in those days, husbands were a little older than wives. Ukki was 7 years older than mummi. And Ukki died early at 69, leaving my Finnish grandmother alone for 32 years. And while she lived independently in her apartment with minimal services, which were paid for by the Finnish government, she did need some assistance in the last few years of life. On the right-hand side is my mother soon after moving to North Carolina, walking in the cotton fields with my grandparents. My mother was pregnant with me at the time. And again, in that case, my grandfather outlived my grandmother by about 8 years. And she continued to live in their farmhouse for a while until a health incident forced her to move closer to one of her sons. But we brought help into her home, and she extended the time that she could live happily in her own home and neighborhood. So some relevant facts. These were from Atul Gawande's book, Being Mortal. He said the average senior needs some amount of help for the last 8 years. And that help might be nothing more than someone to come empty your gutters and mow your lawn. Or it could be someone to take over some of the financial management of your affairs. But they say on average, folks need significant need for the last 2.5 years of life. Women on average need significant help with activities of daily living, which are bathing and dressing and feeding and transferring oneself and toileting for the last 3.7 years, and men for the last 2.2 years. Of course, downtown, we're walkers and connected, and we might not fit this mode, but it's good to know that these are the statistics. So the blue zones, what we're trying to create in Raleigh Village East is our own blue zone. And these are, some of you may be familiar, a concept that was named by a photographer, Dan Buettner, who wrote and photographed for National Geographic for years. And during his travels, he found these 5 areas where people lived healthfully into their 80s, 90s, and even hundreds. And he was wondering what really set them apart. And yes, we can anticipate some of those things, like they were active and had healthier diets. But a key point that he really emphasizes is that on average, the people living in, and I'll name the countries, it was in Greece, in Japan, in Costa Rica, in Italy, and in Loma Linda, California, at the Adventist community, was that on average, the typical person in this community would have as many as 20 social touches a day. And that could be taking your, getting the mail from your mailman. It could be casual conversations while walking the dog or walking out to get the newspaper or going to the grocery store. But these people also had at least 6 intimate friends that they could call on at a moment of sheer need, at a critical moment. In the United States, let's see, 1/3 of Americans have 2 or less people that they can lean on in a moment of crisis. 1/4 of Americans say they have no one to talk to. I was in a call yesterday on a panel with Dementia Alliance, and Lisa Levine, their educator, was saying that she had noticed a lot of decline among the older people with even the early signs of cognitive decline because of the lack of socialization that they normally had. When we socialize, there's a hormone that's released in our brains that actually bathes our brains in a protective way. and we, because our human connections cannot be rote, we're always having to be responsive, it keeps our brains healthier. So this pandemic is worrisome and forces us to learn ways to stay socially engaged and assess, what we can do to stay safe, but also connected. Actually, I want to go back one more thing because I just came across psychology professor at Brigham Young, Dr. Holt Lundstad, who did who looked at over 148 studies following people and what distinguished, a healthy older age. And she said that social connection or insufficient social connection is a bigger risk factor than obesity, smoking up to 15 cigarettes a day, or being an alcoholic. So it really is critical. And if nothing else, if you leave with nothing else, I hope you leave with the confidence that, Oakwood and the surrounding neighborhoods have done so much to build that social connection that there really is a cost to leaving that. There's a wonderful American Nun Study that's been going on for many years, but recently an anthropologist, Anna Corwin from California, who has gone in to live with them for periods of time over the last 10 years, has been publishing her work. And she's found, she's been trying, like Dan Buettner did with National Geographic, to understand why they live as long and healthfully as they do. And some things that the nuns conveyed was, of course, they have a kind of a regimented schedule in which they all go to mass or morning prayer and evening prayer. They eat communal meals. They greet one another. They're physically walking to different buildings each day. But they also see aging as not good or bad. It's simply part of life. And so they understand that there are times when they are the ones helping care for their older sisters, and then one day when they are in need of care, they are accepting the care from those who are able. There's, yeah. So what are the most common needs that people have as they age? As we mentioned, in-person socializing, and we've been getting more creative with how to do that while staying protected from COVID. The music concerts on the corners were lovely. The Awesomettes just did a beautiful performance recently for Peter's 80th birthday. I'm just starting to experiment with some porch visits with masks and fans outdoors. I see a number of neighbors going on walks regularly. In any case, I encourage you to get some sunlight when you can, and see if there are workarounds during coronavirus that will enable you to have that in-person socializing. I mean, someone was joking that this is the 4th Zoom call that they've been on today, and we need more than Zoom, as we all know. But when we are forced to do Zoom, then many of us are using it in lots of ways, from family calls on Sunday. Some families are more connected, especially families that are calling in from across the country or even across the world at regular junctures. I know there's an active Zoom group meeting for the Garden Club. I'm not sure how many of you know about watch parties. My son taught me about this. Netflix and Amazon lets you invite people to watch a movie at the same moment. I know that our church is doing this. I know that a group that I'm involved with from graduate school, we pick nights to have certain movie nights together. And it lets you watch the movie exactly in time and chat with one another during the movie. Some people are having dinner meetings on Zoom, book clubs, online games. And I think with Raleigh Village East, maybe there might even be a need of, expanding that list so that we're all stretching how we're using the tools that we have. We know that staying physically fit is critical. I know people are hesitant to get out and walk in groups, but I do see some people walking at a distance with one another. I would encourage Raleigh Village East to even consider having a once-a-month walking club. We have the cemetery right there. Without traffic. And again, it's getting outside with a little bit of sunlight and building your relationships, maybe even saving your marriage, because you can get it all out on that walk. I myself, for biking, I've started following my son on the greenways. More places like the Y and senior centers and resources for seniors are putting exercise classes online. There's a great series for those who are having some balance issues or whose parents are having some balance issues, called Moving for Better Balance, that the Y is sharing online, as is Resources for Seniors. This can reduce fall risk by 55%. It involves a lot of kind of Tai Chi and movement. Yard work. We all have ways to stay physically fit. Staying mentally fit. I love this story. Let me find her name. It is Jane Bridgers. I met Jane Bridgers, and any story that I share on here, the individual has given me permission, and I have shared it already on WREL. But Jane Bridgers was a single mom of 5 kids and had a full-time job when she had a stroke and lost use of the left side of her body. She went into rehab religiously 3 times a week for almost a year, at which point her rehab physician said, "We can't do anything else for you." And she had not regained enough strength in her left hand, maybe it was her right hand, to enable her to do activities that she used to do, such as drive and other things. And she said, "But I haven't progressed as much as I want." And the physician said, "Well, find some way. Do you have any hobbies or something that you'd like to learn that would be a natural way of doing rehab?" Well, long story short, she went to pottery and sculpture classes. She tried to throw bowls, but realized that she didn't have the same strength in both hands. But she loved sculpture, and she started a whole second life as a sculptor, and becoming involved with artists in Raleigh. I tell you her story with the hope that when some challenge arises, there may be a way to stay mentally flexible and creative that will help you work around that challenge and maybe even see it as a strength or silver lining. I mentioned meditation here. We are all at an age where we have had challenges that we have dealt with in the past, and maybe we've developed meditation or other strategies. I mentioned meditation because there is a lot of good that can come from being familiar with your own mind and your thoughts. It is very easy, and it is our human inclination to worry, especially if we don't know what's in front of us. And I mean, in today's world, we've got the pandemic, with the economy, we have the elections coming up. There's a lot to fuss around in our brains. And that stress and that perseveration is bad for us as we age. Meditation is a wonderful way to become aware and let go of those thoughts and to come back to the present. Learning something new, Jane was a great story for that. Sometimes we do need extra help, and if we, whether that's therapy or a support group, there are now Medicare covers telehealth, so you can get coverage for televisits with a therapist, but there are also groups like Silver Linings that will send a therapist to your house. Silver Linings specializes in people who are homebound. Support groups. There are so many wonderful support groups, and if you have tried them before and not liked them, maybe you haven't found the right one. But support groups are a great bridge when you have a challenge, whether that's a health incident, whether that's a caregiver stress incident, addiction, family issues. This is a group of, could be from 5 to many more people who get together, many online these days, and share their stories and how they have, some people might have figured out a solution or something for you to try there in that group. I myself have benefited from support groups. Be of service. You know, we never let go of the need for purpose. And I know that many of us are already involved in service through our work or through our free time. Here is one great story. Jerry Kroll, whose daughter was the director of the SPCA. And she said to her dad, who was in his 80s, that she needed some help with the adoption program at the SPCA. And he's like, you know, I don't know. I mean, I like dogs, but what kind of help do you need? And she said, well, I could just use your assistance, you know, a couple of mornings a week to help people socialize with a dog. And so at 86, he started going out there 4 mornings a week. And he didn't want to walk around a lot, but he would pick the dog that had been at the shelter for the longest period of time, or the most difficult dog that no one wanted to adopt. And he would go sit in his rocking chair outside the SPCA, and inevitably someone would adopt that dog. Over the course of 3 years, they started a program called Jerry's Dogs. And so they would have a sign on the least liked animal, or the longest animal who had been at the SPCA as a Jerry dog. And they adopted out over 150 of Jerry's dogs. And again, he was surprised by how much pleasure he got by getting his hands dirty, and he figured out the right way to volunteer and be of service that worked with his physical limitations. Have fun. Well, I mean, everybody knows about the Oakwood Awesomettes. I had the pleasure of spending one evening with them, with Twiddlestick and Twirly Temple, the 15 women between the ages of 54 and 84 who make up the group, and perform at Christmas and birthdays and in parades and fundraisers. Who wouldn't love them? Who wouldn't want to be them? They are a traveling group of best friends who didn't know each other before they started. Many were widows or divorcees, but somewhere along the way, Ann Robertson said, this group became much more about sewing and twirling and marching. It really became about taking care of each other and about loving one another. It is important to continue to get together in fun ways. And this group just is a shining example of the gift that has become for the individuals and anyone who views them. I don't know if many of you, let me get my notes. Many of you know of the psychologist Erickson. He was the one who wrote about the 8 stages of psychosocial development over a lifetime. And after he passed away, his widow found one more chapter that was unpublished. He had written it as he was declining and became increasingly dependent on others to take care of him. He said that there was yet one more stage of growth when you were completely dependent on others. In my experience with friends and family members and clients through the end of life, I have seen some really lovely blossomings happen when relationships can change, and when someone who is always taking care of others allows others to take care of them. There's an echo of the Nun Study in that story, for sure. So before I moved back to Raleigh, to Oakwood, my husband and I lived with 2 of our 3 kids in Japan. And he was brought over there to teach the Western perspective of medicine in their medical school. But he had a wonderful job where he was off exploring Japan, and I was at home with a newborn and a toddler. So by the time he would get home on a Friday afternoon, I would just pass him the babies and I would say, I'm heading to the bathhouse. And so in Japan, they have, like we have YMCAs here, they have these traditional bathhouses in neighborhoods. There's this tiny fee to get into them, and you can stay as long as you want. And I would go to this bathhouse that was a couple of blocks from our apartment, arriving around 7 in the evening, and the entire front of the bathhouse would be crowded with parked walkers. something I don't see at the Y. There's a discomfort about getting out with a walker, I've found here in the United States. But in any case, I would go into the bathhouse, and though I was in my late 30s, you know, I don't think I think I was the youngest by 50 or 60 years. These women would be there for hours. They were dear friends, and they were not going to let the the barrier of not being able to walk unassisted to the bathhouse prevent them from getting together with friends. And I feel like that is another lesson that whether it's a walker or any other kind of tool that enables us ultimately to do what we want to do and live in the way that we want to live, we should put pride aside. So Amy Everett, I met this darling woman at the Vision Support Group at Magnolia Glen Assisted Living and Independent Living. And she was leading it, and there were about 10 of us, and she was pulling all of these tools out of her pocketbook. And she had a magnifying glass that had a flashlight on it, and read aloud her when she ran it along the lines of her menu or her newspaper. And I said, Amy, do you mind if I walk back to your apartment with you? I'd like to ask you some more questions about this. And she said, sure, come on. And she is legally blind, so she had memorized the path, and she ran her hand along a strip on the hallway back to her apartment on the 3rd floor in independent living, where she had been for a couple of years. And we got there, and she showed me how she had someone coordinate her closet so she could always grab a pair of black pants and a colorful shirt on one side. She had an enormous television monitor for her computer screen so that she could, and she had set it up to read aloud emails from her grandchildren. She had all kinds of tools like this around the apartment. And, you know, before we moved to Japan, I lived in San Francisco, where I was part of a group building things for the web in the very beginning days. And Amy Everett belonged out there because she was a renegade. She had figured out what she wanted to do, and she was reaching for any tool that would enable her to do it. There came a point when I was trying to tell her how much I admired her. And she said, honey, I hate to go, but you know, I got to go teach water aerobics, so you're going to have to scurry along. So full life. I have a picture of Bernie, another gentleman in Carborough who's in his 90s, who writes a blog on how he continues to live independently and his workarounds. He had a friend set up a television screen too, so that he could read the newspaper with a magnifying glass. Again, I'm just mentioning, you run into a roadblock, there are workarounds. It's not open right now, but there's a wonderful place called the North Carolina Assistive Technology Program, and they have a library of hundreds of pieces of equipment that you can go borrow for 2 weeks, see if you like it, and then you can purchase it yourself. So, so that you don't have all that equipment that just goes unused because you found it useless ultimately after you bought it. Some other tools that are great, you know, medication reminders. It's one of the top 10 reasons older people end up in the emergency room is taking their medication incorrectly. So, I mean, I don't know how many of you are aware of blister packs. This is a really popular thing. I don't think Person Street can do blister packs, but Person Street does do synchronization of your medications and delivery. Hayes Barton will also package them in blister packs by the time of day that you need to take it, and make sure that you're not short of refills. And it's been a lifesaver for a number of folks. Other tools, we've gotten good, much better about telemedicine. Before the pandemic, less than 1% ever had an appointment online, but now it's close to 19% of people have had online appointments with their physicians. Low-tech things, paper calendars and reminders. Alexa, how many people use that to ask what time is it? What's the weather? Motion detector lights. These can be great for preventing falls at nighttime. There are apps. There's a wonderful Uber service called GoGo Grandparent with drivers who can accommodate walkers or wheelchairs. And certainly with the pandemic, we've gotten much better access to delivery services for groceries, dinners, and so on. Communication, phones, FaceTime, Zoom, and texting. In fact, I'm going to tell you how my mom has started using texting after getting her iPhone, which she resisted for years. So there's my mom on the left-hand side, Raya. And there I am. My daughters downloaded an application called Bitmoji on our telephones, which creates a little kind of likeness of us, and we can send each other messages using Bitmoji. And you know, she seemed kind of confused when she was first using this, but she was a fast adapter. And here is one exchange we had when I had to get my first colonoscopy. I sent her a picture of the liquid and a picture of myself, and she texted immediately back. So, you know, technology, when you learn how to use it, it can change the way you speak to one another, right? We talked about telehealth. There are also, for those who don't know, there are also doctors who make house calls. There's a group called Doctors Making House Calls that you can sign up and have the physician come to your house. The Fisher Clinic is a wonderful clinic that's right on Blunt Street, and boy, that's convenient if you do need to go in, but sometimes they make house calls too. There are physical therapy groups that are set up to do solely mobile therapy. So they come to your house with their equipment. It can be daunting to if you've had an injury, to get out to Rex to see your physical therapist. And there are some very good ones that Medicare will cover that will come to your house. Memory issues. So 1 in 3 people over the age of 85 have some, even if it's the beginning, bit of dementia. And this can quickly become overwhelming to handle solely at home. You can certainly, I know that other villages develop a database of volunteers to come and sit with people in the neighborhood. There are certainly private individuals who you can also get, or agencies. The hourly cost for private individuals, in my experience, tends to be about $20 an hour, 20 to 25, depending on how much personal care is involved. Agencies tend to charge $23 to $26 an hour and require 4 to 6 hour minimums, and sometimes 3 or 4 times a week. Whereas private aides are a little more flexible. If there are memory issues, there are some wonderful adult day programs. I had no idea that these existed until I needed to. Some are closed due to COVID, but there are some that are still open. And these adult day programs are a wonderful way to get a little bit of respite for someone with cognitive issues. You can drop your loved one off at some place like Sarah Care or Edenton Street has the Ruth Sheets Day Center. And during the day, they'll be led through different activities from singing to visiting having preschoolers come in to cooking, to crafts, and they'll have 2 hot home fixed meals. And when you are a sole caregiver of someone with dementia, it's important to know that research has shown it increases your chance of cognitive problems by 60% from the stress over time. So another story. Let me find her name, Tracy Lind. I heard her speak at Christ Church a year ago. She was the former dean of Trinity Episcopal Cathedral in Cleveland, who was diagnosed with frontotemporal dementia early in her late 50s, right at the height of her career. And her physician said, it's time to get your things in order. And she and her partner, who had just built their dream house, realized that their dream house was far from family and they would need the support of family. So she let go of her job and they decided to take a cargo ship to England. And as she was a minister, she began to pray. And during those 2 weeks in the bottom of the cargo ship, she came to the awareness that she could see this diagnosis as a pilgrimage or a death sentence, that how she faced this could be with grace or with resistance. And while difficult, she endeavored to do the former. She felt like this would be her last sermon, in a sense. Starting a new tradition, sometimes it feels impossible, that maybe we're too old or our parents are too old to do anything differently. But after my mother-in-law passed away, my father-in-law's great aunt, Sarah, at the age of 85, said, "I'm sick of going to funerals. I want to start going to birthday parties." And so she said, "I'm going to have the biggest barbecue on October 15th every year in Fayetteville." And so we would my kids grew up going to Aunt Sarah's for barbecue, and we got to know a wider part of my husband's family who had lived at a distance. People would fly in from California and Chicago and from all over North Carolina, drive in. And this becomes especially beautiful in that at 94, I believe, yes, at 94, when she went to the hospital and was put on hospice, she told them she wanted to die at home. And many of the people who had been attending those birthday parties, we signed up for shifts. And so I spent a night and a morning there so that her daughter, who was in her 70s, could get some reprieve with the great Aunt Sarah. This makes me think of the wonderful program that Carol Wood started not too long ago, after they noticed that there were a number of people in their skilled nursing who were dying alone because they had no family. And so they started a training program called No One Dies Alone, in which people would sign up for shifts to be with someone during the last 48 to 96 hours of life, so that no one would indeed be alone when they passed away. And again, I don't know if Raleigh Village East will do something like this, but a side effect of this program is that it reduces fear. Death becomes less scary. It becomes more familiar. And there's an intimacy in learning about death with a group of people who sit with one another. So how can we continue to grow? You know, maybe this presentation has seeded some ideas, but that's what we want to do, is we want to continue to grow until the end. It would be irresponsible if I didn't mention home modification. After all, we live in homes that are not exactly age-friendly unless we make some changes. And you know, there are low-tech, inexpensive ways that we can make them age-friendly. Reducing clutter is a pretty quick and cheap way to do that. Motion detecting lighting is pretty important. Nighttime falls are very common. I mean, none of us think that we're going to fall. Trish Wilson, who's on this call, she and I went biking on the Greenway last week, and we think we're pretty strong, but man, we took a bad spill on one of those bridges. Neither of us expected it. And in my experience, when I've gotten calls from people who are at the hospital, no one anticipates it. I've stepped down those stairs a million times. I don't know why I missed that last step. So lighting and knowing that as we get older, we tend to drag our foot a little bit more, not being aware of that, tripping on things. Stairs are a big issue. If possible, you want to have at least a bathroom that is accessible on the main level. You can always change, you know, a dining room into a bedroom downstairs if need be, but it becomes really hard if, for example, you've broken something and you must use a walker as you're getting stronger again. Does that doorway accommodate a walker? Because if you are a furniture walker, which, you know, you're barely making it from one to the next during a time when you're more vulnerable, then it's dangerous to not be able to get to the toilet, and you might just have to use a bedside commode. And that goes back to letting go of our pride and using the tools we need to stay safe at home. And there are wonderful groups of physical therapists and occupational therapists that will come to your home and do a safety assessment and give you some idea, as well as recommend certain builders who can make modifications to your home. So home modification is probably the most expensive thing, but I've mentioned a bunch of tools over the course of this talk. And many people go, oh, I'm not going to use an aid because that's too expensive. I'm not going to make a change to my house because I can't afford it. But I want you to keep in mind the cost of moving to an assisted living or continuing care retirement community or skilled nursing per month. These are ranges, but continuing care retirement communities, which many require some kind of buy-in, that can go from $20,000, somewhere like the Cardinal, up to over $1 million, plus your monthly rental fees. Independent living in this region can go for a single person from $2,500 a month to $6,500 a month. Assisted from $45,000 up to $11,000 a month. You're going to forget all these numbers, but if you leave with nothing else from this slide, I want you to be aware that maybe an investment that keeps you safe at home versus going out to a community might be well worth it over the long term. So village to village model variations. There are lots of villages that have been around for a while. There are plenty of books. I know Sarah and Peter and Catherine and others have looked at examples of how different ones set themselves up. Some are free, some ask for some kind of fee, it seems like all of them at a minimum provide some kind of vetted list of service providers, which neighbors have used and can provide real information about the costs and the efficacy and so on. Many also have a volunteer pool. A wonderful one for those who are not aware of them, and I didn't know about them until recently, is Farrington Cares over in Pittsboro. They started before Beacon Hill. They started in 1989, and they have gotten some impressive things in place. I wasn't able to interview Karen Metzger, the executive director, who's also a nurse, before our conversation today, because they are finishing up another new common building that they recently built. They have 1,373 residences that are members and 2,300 inhabitants. They started tallying just how much they had accomplished in a year, in terms of visits and rides and repair visits and computer help visits. We're in the pandemic. We're at the very beginning stages of this Raleigh Village East. But again, food for thought and seeds. So I guess I'd like to end with, this is, as is life, an ever-changing puzzle. We can't prepare for everything. Life will bring surprises however old we are. But in community and with the goal of helping each other extend the time that we stay together, we can figure out a lot more than we can alone. And so I am going, here's one more story from Japan. Maybe some of you are overwhelmed by all of the things that I brought up, and I know it triggers a lot of thoughts. In Japan, they still have the tradition of Japanese cormorant fishing. And how that works is they go out in boats and they have a little string with a ring on it. The ring goes around the cormorant's neck and the string goes to the fisherman in the boat. And the fisherman, to motivate the cormorants, slices up tiny pieces of fish that the cormorant can still swallow in spite of the ring around their throat. And I want you to keep that image with you as you leave. And are there rings around that you are keeping metaphorically, in terms of what you perceive you can or can't do in order to continue to live a full life? We all have them, but the more we talk about these kinds of things and illuminate them, they become less enslaving. Finally, I have written, as I mentioned, over 200 articles for WREL on questions that readers write into me, clients bring to me, or information that is of use, especially like now during the pandemic. So if you have a question, I've probably already answered it, but I'm happy to answer it if I haven't.